Welcome back to For the Record. Joining me now is Jennifer Brown, a United Healthcare customer and Prisma Health patient. Jennifer, tell me about your family.
I have 3 sons. My middle son, Keegan Brown, was born with a congenital heart defect. He was born with a bicuspid aorta. His first intervention was at 9 weeks old. He's had 3 valvuloplasties where they blow open your valve to open it. He's had 2 open hearts. The last open heart was an emergency. He went septic. He had 4 strokes, kidney failure, kidney injury, and he required a transplant, a human donor heart valve, which he got in 2015 and he still has.
Just one of those procedures without insurance could cripple a family for generations.
Yeah, his 2013 procedure, I just finished paying off in December of this year, or last year.
How is he right now?
Right now, he is doing well. He's stable. He still requires continued care from a congenital specialist. And unfortunately, that congenital specialist is out of network because of the Prisma and United difficulty.
Your story, your son's story, is a prime example of the pain in the middle of this debate and this battle and conversation about healthcare providers, insurance providers,
and you know, you want them both to win because they're both necessary,
absolutely,
but not at the expense of your child. And right now, we have no congenital heart specialists except for the one in Charleston. So we will have to drive 4 hours for him to get the medical care that he needs. And that's unacceptable. We have a specialist right here in Greenville who's wonderful.
Yeah. And who knows your son.
Who knows my son.
Knows
he has
everything.
grown up with all of his specialists.
Yeah.
He has grown up with all of, and you can't just go to a different doctor. Like, okay, my nephrologist isn't covered. Let me pick a different one that's in network. With pediatrics, there is one network, one, and it's Prisma Health, and they know that. And you know, they need to at least come up with some sort of plan for the special needs in their community.
Are you angry? Are you hurt?
I am both, yeah. I mean, I've watched my son struggle to breathe. You know, they've stopped his heart on more than one occasion. And he's lived through that and he's thrived. And they did save his life in 2015. But now, you know, it's Congenital Heart Disease Awareness Week. And I think it's the perfect week to talk about access to care. And continued care for these patients is vital. His lifespan could be cut short if he doesn't continue to get the care he needs.
How old is he again?
He is 19.
So he's totally aware of...
Oh, he's scared. Yeah, because over the summer, he had chest pain. He was scared to death. He thought that his human donor valve was not going to last forever. Normally, they last about 5 years. We're on year 8. So he was terrified. I said, go straight to the emergency room. We went to the emergency room at Prisma because that's where all his specialists are. Now to know, like, will it be covered? I don't know, you know.
I mean...
Could they say, well, it really wasn't an emergency, so now you're on the hook for the bill? That creates such incredible stress. We've already paid hundreds because we had appointments booked.
True.
So we've already financially taken a hit from this, and that's not fair.
Through stories we've done, we've been told that Prisma says call United Healthcare. United Healthcare says call Prisma. Have you done that?
After I spoke with Ray, United Healthcare did call me the very next morning. They assigned him a caseworker, but the caseworker can't make another specialist.
What is your prayer?
My prayer is that they would think about the lives that they're affecting. 60,000. You know, many of those are children like my son who need that access to care. We're in a medical desert because there is no care. I'll drive 4 hours. What if I didn't have a car?
Yeah.
You know, my son gets car sick.
Yeah.
That's undue burden on the people in your community who are the most vulnerable and under so much stress already.
Thank you so much for sharing your story.
Thank you.
Still to come, our conversation continues about insurance and healthcare provider negotiations.